Well, I got claps. I'm leaving. Thank you so much. So today I broke this presentation into two parts. The first part is what I like to call the evolution of employee screening. And this is really through the lens of DISA Global Solutions and how we've seen owner-operator groups deal with their contractor companies in order to manage compliance. Then the second part of the presentation is focused on what we're calling our annual owner survey. So again, further diving into the details of how owner sites manage compliance and processes and ultimately the workers coming on site to create a safer, more secure workforce. So with the evolution of drug testing, I'm going to start back in 1989. And you all have seen some presentations that touched on Department of Transportation regulations being initiated with the Drug-Free Workplace Act in '88, and then ultimately Department of Transportation regulations in 1989. And then fast forward through the years up until the last few years. And what I want to touch on are the different methodologies, the drugs of abuse, and the science that has been implemented to combat those abuse trends. So where it all started, 1989 with the Department of Transportation. Really what the government did was initiate a baseline. And when you go back to the late 80s, it was the start of this industry where you had more formal processes and procedures that non-regulated companies could point to and say, if the government is following this process, we can follow it as well. So some of the details around this. It was a 5-panel urinalysis test, and I'm preaching to the choir with a number of you, but long story short, you'll see in the subsequent slides a lot of the new drug trends that come about and how we're attacking them. But again, you can see your traditional 5 drugs, and then the various required tests. And this is important because this really defined the when, the where, the why, and the what are we testing for. Now, jump to the early 90s, and again, through the DISA lens, there was an initiative that basically said, we have contractor companies that are coming onto our properties. So picture a refinery. Those owners, those refineries, didn't have visibility into what the contractor company's programs were. They definitely didn't have visibility into the various testing that occurred within those contractor companies, those employers. And so this concept was formed, and basically the whole goal there was to do a couple things. One, standardize the actual drug testing policies and procedures. So again, with Department of Transportation starting in '89, you had this formalized, but it was specific to a certain group of companies and more importantly, workers in their job roles. So this is really predominantly focused with non-DOT, which allowed those owners to add additional drugs. And so in the early 90s, you started to see the prevalence of what we call a 10-panel urinalysis drug test. So 10 different drugs of abuse. And you can see a number of them start to be more pharmaceutical-based drugs. A couple key differences. Non-federally regulated, so again, this is for non-DOT workers that are going on site. Initially, it's focused on the downstream energy sector. So think about refineries, petrochemical facilities, and chemical sites. And then obviously, we've got those additional drugs. So I started with DISA in 2002, so I've lived through a number of these additions and changes over the years. A lot of folks in the room that I've worked with for the last 16 years have at least seen that amount of history, if not more. But you really don't have a lot of change with regards to new sciences being implemented at the contractor company level as it relates to this contractor compliance. The reason I call out the next couple slides is because background checks in the second part of this presentation, we've got some good data, and we've seen that over the last several years as a very strong emerging trend with regards to creating a more safe and secure workplace. So in 2006, unlike drug testing, where I don't want to offend anyone, say it's easy, but there's a positive and a negative result. With background screening, you've got a number of different products, you've got a number of different data points that could come back, dispositions, and it's also left up to interpretation. So there's a very high likelihood that two individuals could review a report and potentially interpret it differently. So what we wanted to do was identify what are the specific products we're looking at, how do you grade and evaluate those, and then what is the disqualifier, or that positive versus negative. And I'll touch on that later in the presentation. Now the neat thing about this was in 2006, these are a number of energy companies that started putting this initiative together, evaluating the various products and dispositions, or the records that would disqualify an individual from coming on site. And this is actually a year prior to what's known as CFATS, or the Chemical Facility Anti-Terrorism Standards. Now, CFATS was obviously focused on chemical facilities or facilities that had certain chemical compounds and materials within them or transported it in and out of them. But the reality was the government was looking to create a more safe and secure facility. And again, this is all kind of under the guise of terrorist threats. And so 2006, this program gets developed by industry, by the energy sector. In 2007, you see this law is authorized by Congress. So pretty exciting stuff, because essentially what was developed in 2006 met the requirements of the CFATS that came out a year later. So then jump to 2008. And hair testing, and some of you might have heard Richard Clay speaking in one of the first sessions this morning. Hair testing has been around a very long time. But in 2008, you started to see hair testing being introduced to the contractor community on behalf of the owner sites. So again, these refineries telling their contractor companies that hair testing is a requirement. Now, what we saw and what we continue to see is that hair testing is required in addition to a near-term detection. Urinalysis is the example. The benefit of putting these two together is that you're capturing both the pros of urinalysis as well as hair testing. Only con is it's two tests, so you're seeing an increased cost or potentially increased testing frequency simply because you have to perform those multiple tests. The benefits have been outlined pretty thoroughly today, but again, some of the pros of hair testing, it's got that longer window of detection. So again, once that hair grows out past the scalp, call it 7 days, you've got up to a 90-day detection window. So it's like a little tape recorder. And when you combine that with the urinalysis, which is hypersensitive, can capture a number of additional drugs beyond that 5-panel test, you've really got the 1-2 punch. All of these programs are designed as a deterrent first, and then second, detection. So ideally, and you'll hear a lot about communication and employee education in the later slides, but the reality is getting the word out there that these programs exist, getting the word out there about how these programs operated and how it could impact that worker, hopefully acts as the deterrent. If it doesn't, and this is why we have positivity rates, it's definitely used as a detection tool. One of the benefits, just to call out, 100% observed collection, and you'll see that in a later methodology as well. So then in 2010, if you watch the news at all, you're hearing about the opioid epidemic. And this is something that is unbelievably real and costing billions and billions of dollars, not just within the workforce, but just in personal lives as well. Well, this was something that hit the radar in 2010 and needed to be addressed. So you started to see the modification of policies, and more importantly, panels, where they started adding these additional drugs of abuse under that opiate, now known as the opioid category. You can see some of the stats here. It's staggering the amount of people that are impacted, the amount of costs that flow through to you as the employer. So it's definitely something where you want to make sure, one, you've got that education, you've got that deterrent, but ultimately, unfortunately, that detection is very, very real. So this 10 panel with expanded opioids addresses that with the detection perspective. So then, and the stories around synthetic testing as it relates to synthetic THC or fake pot and bath salts or synthetic cocaine are awesome, but we can save that for the networking event. In 2012, though, you started to see this influx of overdoses from what appeared to be marijuana. And what was really scary, and this is why it hit the media very, very quickly, you had, in a lot of cases, teenagers that were overdosing and dying from apparent marijuana overdoses. And that just doesn't happen. And so the industry, and when I say industry, the drug testing industry responded very, very quickly, started identifying that there were these compounds out there, these synthetic chemical drugs that basically mimicked the real stuff. However, in most cases, the potency was off the charts. And when I say off the charts, potentially 400 times as potent. So now you're seeing individuals that are thinking they're doing something that can be moderated, and in no way can it. So synthetic THC hit the market. It was K2 Spice. There was one drug being detected. Over the years, that science has evolved. The research and development has been focused on identifying more drugs of abuse. But those early days, as we started to be able to test for this stuff, we started seeing positivity rates go from 0, because we weren't testing the right drugs, through the roof. And they were double and triple what we were seeing with traditional drugs of abuse on these, these prior panels. Now, over the last few years, we've started to see a rapid decline of the positivity rates. And that could be for a few reasons. One, maybe it's different chemical compounds that are being utilized. With that said, these compounds that were being abused were made Schedule I or illegal, so you started to see the supply go down. Around the same time, you also started to see legalization of marijuana. So now it's less taboo, it's more readily available to use the real stuff, and although potency rates can vary dramatically, when you think about the synthetic compounds being up to 400 times as potent, users aren't exposing themselves to those undue risks. So again, we saw this steep incline and then a pretty rapid decline over the last few years. This drug panel and these drugs are still actively being tested for in a number of programs that a lot of you in the room are utilizing. So we're monitoring positivity rates. The laboratories are constantly attacking the science to see what more they can do to detect if it is there. So just more of an FYI on that. So then most recently, 2015, and again, the science has existed, but we saw the introduction on the energy sector of oral fluid testing. And one of the key call-outs, very similar to hair testing, was that it's 100% observed collection. So not as many games being played. And what the labs have seen industry-wide, and again, I say industry across all industries, are positivity rates that in some cases equal urinalysis testing, and every now and then, depending on the industry, might even exceed it. And that really speaks to the fact that there were a lot of games being played with urinalysis collection, tampering with that test, and so the oral fluid process is definitely reducing that. We have seen this replace urinalysis testing, and again, when it's utilized in addition to, it would be used in addition to a longer detection window solution, hair testing. So I know I went through that evolution fairly quickly. This is a snapshot of 2017 testing data. This is based on the specific energy sector. So like I said, with oral fluid testing across multiple industries, the positivity rates have actually shown up much higher. So there could be a number of reasons for this, but just to kind of call it out, when you think about the 5-panel urinalysis, it's hovering about 1% for this workforce that we're focused on, where when you increase it to that 10-panel urinalysis, it jumps up significantly. And then you've got the hair testing, which again, significantly higher. The one interesting point here is the #1 drug of choice with hair testing is cocaine. And so in some cases, we are identifying an additional drug for the same drug abuser that's been identified with some of these other methodologies. In other cases, we're actually identifying a new drug user. For those of you who aren't familiar with it, cocaine is a water-soluble drug. It metabolizes in your system very, very quickly. So the window of detection is short. I mean, it could be a matter of 1 to 3 days. And so when you think about having a tape recorder, that definitely lends to the value of identifying that as the #1 drug of choice. I've always thought about employee screening. I segment it into 3 buckets. The first one is corporate. So this is the company's policy, the company's choice. Department of Transportation is the second bucket I think about. And again, this is federally regulated. So the government saying you need to do these screens in order to comply. And then that third one is that client-driven requirement. And this evolution with all of these different methodologies and drugs of abuse to test for, that has been driven over the years by the owners that don't have that visibility into what the contractor companies and their employees are doing as far as a program. And so, unfortunately, what you've seen are variances with the different requirements of these owners. There are consistencies with some of them. So when you think about a 10-panel urinalysis test, you have a high number of individuals that are utilizing that. But then you'll see some deviations, whether it's oral fluid, whether it's hair testing, whether it's additional drugs of abuse that are of particular concern to that owner group versus other owner groups. And I'll touch on that in a little bit with some of our survey data. Another thing, and this has been called out, Donna Smith did a great job pointing out, it's not one size fits all. So definitely consider safety sensitive versus non-safety sensitive, locations, client requirements, et cetera. You've got a number of methodologies to choose from. You want to think about the test purpose, the random program, not just the percentage, because those can absolutely vary, but also the frequency. Rehab is definitely something to consider, and it may be as simple as, no, we do not allow rehab, but certainly if you do, you want to get into detail on those rules. And then medical disclosures, which again, Donna touched on in an earlier session. And the whole goal there is realizing that legitimate drug use absolutely could still cause impairment, and you want to make sure you're protecting not just your company, but the employees working side by side with each other based on job tasks, et cetera. So again, just a handful of call-outs. And this is a bit of an eye chart, but if you go to DISA.com/calculator, Nina French in the session right before this was talking about the various costs of drug abuse, and the numbers are staggering, and you can debate any number you want, whether it's 7,000, 30,000, 100,000. At the end of the day, it's a significant cost to the employer. It's a significant cost to the industry. And so this tool, you can enter in your number of employees, and you can see positivity rates based on the data that we've got or statistical data that we've got, but then it also breaks it out by the cost. So if it's identified that you have 2 drug abusers, statistically, what's the cost of that if they're in a safety-sensitive position versus a non-safety-sensitive position? So the next several slides are based on our first owner survey that we've formally done. Again, we've seen this evolution. There's a lot of stories anecdotally about kind of how it came to be, what we're seeing. We certainly have statistics to support this. But we wanted to go right to these owner groups and ask them more specifically about their drug testing programs for their contractors, their background screening programs, badging systems, portal companies, medical disclosures, employee education. Really get a lot of these questions out there. This survey, like I said, is new to us, so we'll be publishing it probably after the beginning of the year. But this is a snapshot of a lot of the questions and preliminary data that we've received this far. So again, survey goal, identify unbiased best practices throughout safety-sensitive industries relating to the employee screening, and I would say more specifically, the contractor screening and management. So we conducted more than 60 surveys with owner-operators in the oil and gas industry. So think about refining, chemical, petrochem. And this is this far. We'll keep this survey going, and really what we'll do is we'll probably have a 2-year running snapshot So we've got individuals that have conducted this survey over the last few months. We'll keep that rolling into 2019 and continue to combine that. And then really the incentive is, hey, we're going to put together this data high level. We're not going to share anything specific to your company, but you're going to get some good best practices and peer comparisons so you can go out there and evaluate what programs do I have in place, or more importantly, are there things that I haven't thought about or haven't implemented. 80% of them that participated are using DISA in some form or fashion, so we were able to get a lot more detail about their specific policies and in some cases statistics, so that was definitely helpful. So with that, owner trends. First one we asked, have you experienced any theft, violence, or drug-related activity in the past 12 months? And again, you can see 42% of them answered yes. Number one was on-site theft, followed closely by on-site drug-related activity, and fortunately, lower percentage with on-site violence. Now, owners experienced multiple scenarios. So, the reality is you may have theft, drugs, and violence all combined on a site. And so this kind of tees up a lot of the follow-up questions that we're asking, basically to identify, okay, what are the programs in place, what are the thought processes in place that, to combat this. This one was surprising because this is the first annual day with DISA, and there's a lot of you here to learn about, the challenges with marijuana that are affecting a number of states and will continue to affect a lot more. But when we asked the question, are you concerned about increased legal marijuana use by contractors? 61% said no. So, there's some questions that go along with that. We asked about synthetic THC, 58% said no. So, one of the things that we were asking kind of as a follow-up is, have you not been impacted by these questions or concerns with regards to the legalization? Is it not something that's happening in your state, or are you just not aware of it? And I think the great feedback that we've heard kind of in between these sessions is everyone's walking out learning something new. There's a lot of activity around the legalization of marijuana, whether it's recreational or medical. And so it's scary times because as an employer, you're trying to figure out what should my policy say? How do I deal with these employees? But the reality is it's kind of a moving target. So following up on that, because 61% didn't have concerns, we asked the question, how are you educating the workforce that legal marijuana is still prohibited for the 40% that do care? 44% said we're not. So you've got this huge population that even if they're concerned, they're not communicating it. That employee awareness is not taking place. And so this is an opportunity, obviously, for improvement. It was eye-opening, when we started sharing some preliminary stats back to the participating owners. Once we publish, this a little more formally, they'll definitely see that this jumps off the page. And then you can see these traditional safety meetings, toolbox talks, what have you. These are the opportunity to just bring awareness, throw it out there very, very quickly. As simple as if you're sitting in Texas and you have a medical marijuana card, doesn't matter. Doesn't apply in Texas. So it's just one of those things where you want to make sure that you're educating the employees because especially with the contractor workforce, you've got that mobility. You've got individuals working state to state to state where they very well could be in a state where this has been legalized. However, at your site, it may not be allowed. And then they could come to a state where it's absolutely not legal. So, similar question, again, opioid epidemic. We asked, are there concerns regarding the opioid epidemic at your facility? Again, 61% said no. Now this is a little different because they are absolutely testing for opioids in their panels, and whether that's oral fluid, urinalysis, or the hair panel. So one of the thoughts we had here, because everyone believes there's an epidemic, and everyone seems to be aware that there's an epidemic, maybe there's a lower concern simply because they're already testing for it. And so we'll want to conduct some follow-ups to see, if that's the case. But again, interesting information. And again, because this opioid family that's being tested for has that MRO process that is so important with a prescription. Just as an example, we asked, do you use acknowledgement forms for safety-sensitive positions? 70% said no. And so again, this is not an issue of illicit substance abuse. This is legitimate drug usage that absolutely could cause impairment and create a safety issue. So what are owners testing? So I touched on all those different panels and all those different methodologies in the evolution, and what you're seeing is urinalysis, 93% are testing for that. It's the gold standard, pun intended, I guess. What we've got is 42% are doing hair. And that 42%, all of those cases are hair tests in addition to another methodology. So you're seeing that 1-2 punch. And oral fluid is more of the new development. So that came about in the mid-2015 range and has started to kind of progress. And it's a bit of a tug of war with urinalysis. But in all cases, you saw that 42% adding the hair. And then breath alcohol. Breath alcohol was always in combination with these various programs. So we saw a very high percentage where breath alcohol is just a required component of the program. So is there anything else you want to screen for? This one was unsolicited. There wasn't a pick list in the survey. We just saw that 16% said yes, hair. And that was basically a write-in. So that was the consistent message. So why are owners testing? What are the concerns? So compliance, administrative burden, cost, resource requirements, legal challenges. These are all reasons why you need a policy in place. You need to update that policy very, very consistently and regularly. I did a presentation last year and I asked, how many of you have updated your policy in the last 3 years? 24 months, 12 months, and it was, hands were going down very, very quickly. And so it's just one of those things with so many changes, whether it's drugs being added at the federal level or states making adjustments to, their laws. It's something that you've got to keep on top of. So compliance is huge. Now, this one, what trends are you seeing increasing at your site or location? Number one, and we were having a conversation earlier, I see them in the back, lack of labor pool. So, the challenge, and you'll see this on a number of questions, the quality and availability of the workforce. It is challenging, and a number of you in the room deal with those challenges. How do you staff a job, and more importantly, staff a job with qualified, skilled, safe, secure workers? What's interesting, though, is outside of lack of labor pool, 4 of the top 6 trends or concerns are drug-related, whether it's drug activity, whether it's prescription abuse. And so, drug abuse is absolutely a real threat in a lot of different categories. So then, have you seen a decrease in safety-related incidents since the inception of a drug testing program? Any drug testing program? 71% said yes. So bottom line, drug testing programs work. I think this was even more interesting. Have you seen a decrease in safety-related incidents since the inception of a consortium? So tracking data effectively. An additional 52% saw that improvement. And so you've got this huge percentage of folks that saw it when they implemented the drug testing program, when they implemented tracking and basically compliance tools wrapped around that data, they saw an additional improvement. So staggering numbers. What consortium innovation do you most benefit from? Very, very similar concepts through a couple of different questions as we dove into it. So real-time access, reciprocity, increased testing, but the reduction of redundant testing. So doing the same 10-panel test over and over isn't beneficial. If you're doing multiple tests, switch it up so you're closing different gaps and you're attacking different issues with the right tool. How is the consortium most improved worker safety and health? Again, number one reason, better quality workforce. And they all firmly believe, number 2 reason, fewer incidents. You get that quality workforce, they will operate more safe and more secure. Consortium owners that saw a decrease in safety incidents were asked to elaborate. And again, better quality workforce jumped off the page, and safer facility, I think ultimately was the output of having that quality workforce and programs in place that really kind of drove not just compliance, but really awareness and behavior. So how are owners testing? So is your decision centralized or decentralized? Overwhelmingly centralized. And we've got some of the folks in the room. They're looking for standardization. You know, they're trying to get that consistency, because once that decision is made, if it's a beneficial decision for some of their workers, it can absolutely be a beneficial decision for all the workers. And then, do you mandate one drug testing provider or accept multiple? 71% said mandate one. Again, I'll call it out as a caveat. We surveyed 80% of these folks that are already working with DISA in some form or fashion, so that absolutely contributed to that higher number. But you can see they're accepting multiple providers, and then in some cases, and it's fortunately a smaller percentage, they don't have any mandated providers. And so when we talked about the folks that realized that additional benefit from having a consortium, it's all about that data tracking. It's all about leveraging technology. And so if you don't have that in place, obviously there are going to be gaps in how that data is communicated, which drove the next couple questions. So why do you mandate one provider? Real-time tracking, standardized requirements. Basically, a single point of contact, a single record where you can track that information. It's accessible. It's fast. Do you share contractor compliance information with your peers? So 55% said yes. And again, you're seeing this high percentage in most cases because of these consortium programs, data tracking systems, et cetera. And then, is your contractor screening and compliance standardized? And so of that 55% that's sharing it, 3/4 of them are absolutely standardizing it. And again, they're trying to get the benefit and the economies of scale. So call out was DISA has a high percentage of these people that are utilizing us. You've also got safety councils. We dove into the portals, which I've got some questions on here in a second. And then the good old boy system. And the good old boy system is still alive. I wouldn't say it's alive and well, because there's a lot of gaps in tracking that data, but that's absolutely the way some folks acknowledge that they are operating. So do you integrate with portal companies? And for those of you who might not be familiar with portal companies, these are companies that are aggregating a large amount of various data, whether it's drug testing or background checks or insurance certifications, safety questionnaires. Basically, what these companies are doing is pulling together this information, again, to have a single point of contact. 83% said yes, they are leveraging these types of companies. And overwhelming, you can see a company by the name of IS Networld, but there are a number of other sources, whether it's products like Avetta or Browse, or Safety Council Concepts that have developed solutions, again, to capture all of this information on behalf of the employer, but ultimately somehow boiling that down and representing it to the owners. As far as badging companies, so this was more predominantly on the downstream side. When you think about a refinery or chemical facility, most of them had access badge systems. So you can see 83% use it. I will say we had some offshore exploration and production companies that also had systems in place that they would consider badging systems. When you think about more traditional exploration, production, drilling operations onshore, they definitely do not have the badging systems in place. So that kind of fell under that 17%. And then as far as the badging system types, Linnell was, again, kind of overwhelmingly the badging system of choice, at least with the 60-plus owners that we had surveyed. What unique identifier do you use to track these individuals in the badging system? Again, badge ID was number 1. You can see social security number was number 2. Now, going back just a handful of years, and this is more anecdotally, Social Security number was the only way that these companies were tracking individuals in their badging systems, at least effectively. The Social Security number is being reduced as far as this unique identifier, although you can see a quarter of these folks are still using it. But contractor ID, employee ID, badge ID, some arbitrary number that you've got information embedded behind the scenes. So again, a lot of you deal with this on a daily basis, but this is just a way to track data very, very quickly, again, leveraging technology. So when are owners testing? So we asked a question, do you perform owner-initiated testing? So when I had the test purposes up there for Department of Transportation, you saw a lot of the usual suspects: pre-employment, random, post-accident, reasonable suspicion. When you think about owner-initiated testing or wall-to-wall testing, this is not something that is allowed under DOT regulations. So we're talking about a non-DOT, non-Department of Transportation test. But you can see 36% do have some form of owner-initiated testing. And then when do they actually implement this? 44%, all over the place, right? They're kind of doing it whenever. And whenever could be because a safety incident arose, because drug paraphernalia was found in a certain area of the site, which means the other 56%, they've got pretty formalized procedures or at least thoughts around when are we going to do this. In some cases, it was during projects where they're getting an influx of workers. These individuals are not people that are on their site regularly, so they're going to be on site for a short period of time. And so in most cases, that is when that activity took place. So then we asked, okay, do you provide on-site collections for the nested contractors? So the individuals that are there day in, day out, are you providing a way for them to do drug and alcohol collections on site? You can see it was a pretty small number, 21% that said yes, and then a variety of different scenarios where maybe they've got collectors available on site daily, maybe it's less frequent, but again, the goal there was to provide convenience more so than anything for these individuals getting tested. Now, flip side, we saw much higher percentages when we asked about on-site testing for your contractors, and these are the folks that would be project-based or short service-based where they're not on-site every day. We saw that jump up almost 2 times to 46% saying yes, and then do you have a location on site? And you saw 2/3 of these individuals absolutely establish some on-site solution when you're thinking about a turnaround and you're bringing hundreds or thousands of people incrementally on site for a short period of time. And then where on site do you do your testing? It ranged. There were designated bathroom facilities, or in a lot of cases, you had certain contractor trailers that were being leveraged. So do you offer temporary passes or exemptions? So this would be for an individual who is trying to gain access to a site but hasn't met the various requirements. And these various requirements may be drug testing related, background screening related. They may be something to do with training, but essentially 82% of the owners we surveyed have some kind of exemption process or at least temporary pass process for those individuals. Now, with that said, when you look at who is eligible for the temporary pass, over half of the time there are some restrictions or limitations tied to these temporary passes. So most owners had some program in place, but over half of them said there needs to be a very specific circumstance. We're not just opening up to anybody who hasn't met the requirements. And then you can see which individuals are ultimately responsible for signing off on that. They're putting it on safety and leadership, overwhelmingly. So if I make this temporary pass or exemption, am I making this workplace less safe, less secure? And again, the safety guy absolutely cares about that. Plant management, leadership absolutely cares about that. So that's why you're seeing so many situations where there really needs to be a specific example, like an emergency situation or an escorted employee. So then with regards to kind of the last point around drug testing, we talked about point of collection or quick testing. So everything we've talked about up till now really has been focused on laboratory-based testing, whether it's urinalysis, oral fluid, hair. With regards to point of collections, nearly half of them absolutely utilize it. And then of those half, 85% are tracking the results in some form or fashion. So when we dove into it a little further, we said, okay, well, have you ever had a false positive? 40% have experienced a false positive on point of collection testing. So I think the key there is you've got a large percentage of folks that are leveraging quick tests, but they're also backing it up with laboratory analysis because they've had that experience, or at least there's the perception that that experience can exist. So then finishing up these last slides, I had mentioned background screening as kind of this complement to the drug testing piece. So we asked, do you require background checks? 64% said yes, and I'll explain this in a second, but what is your cut score? You can see overwhelmingly it was a cut score of 2. What that means is that this particular owner will allow a 0, a 1, or a 2. Remember when I said, drug testing is easy and that it's positive or negative? With background screening, there needed to be some form of positive and negative. And so this score, 0 is clear records. You can see 85% of the time when you're looking at the energy sector, no records found. But that means 15% of the time there are records found. And there are varying degrees of these records, ranging from misdemeanors to felonies, and then you actually have a handful at a 7, which are Patriot Act hits. So this gives the owner the flexibility to choose what level or tolerance for risk they're willing to accept, but also gives contractor companies, the employers, the ability to run a background check and apply it based on the score of that individual. Do you have a renewal time frame? 95% said yes, and you can see jumping off the charts, 91% of the time it's every 2 years. Pretty standard. So I think with takeaways, and I'll run through these quickly, but there's absolutely this shift in evolution with regards to methodologies. You're seeing more and more the combination and piecing together these various solutions to really close gaps. As far as communication goes, it is low. And so there's, I guess, the lack of realization that some of these challenges and risks are out there, but also when there is that realization, the communication levels are also very, very low. 44% aren't communicating. Concern for legal marijuana, like I said, is low, and then the constant challenge, that lack of labor pool and really that quality workforce. 71% of owners mandate a single provider. Most share contractor compliance with their peers, whether that's through a consortium, safety council, portal company. 71% saw that reduction in safety-related incidents once they implemented the drug testing program. That's huge. That means these programs work. And then you see the additional 52% see it when there's that data tracking, that consortium concept. Touching on the portal companies again, 83% are using portal companies. 83% are also using badging systems, and ISNet World and Linnell were the ones that kind of bubbled to the top. And then talked about the temporary passes and exemptions, but this is something that these sites have, but in most cases it's absolutely scrutinized to make sure that the right people are getting on site, not having met the qualifications. Point of collection, again, just touched on, 40% false positives for individuals who use point of collection testing. And then from a background check perspective, cut score of a 2 is most common, and that renewal time frame of every 2 years is also off the charts most common. With that, I hear drinks flowing. I appreciate your time. Thank you so much. I'll be available for questions outside.